Hello, everybody. This is Coresair Mack, President of the Illinois Mental Health Counselors Association. And today I am joined by our very own special guest, Andre Joachim. How are you doing today?
Doing great. Andre Joachim.
Joachim. See, that's embarrassing. Well, I had to be corrected at least one of these videos, so at least I'm happy it's with you.
No,
Right. All right. So, for those of you that don't know, Andre and I, we have a little bit of background together, right? So, of course, we went to the same grad school program. But a lot of people don't know that when we were in undergrad, I was his community advisor. So now it's come full circle to where I was the important person, but now I'm interviewing you and you're the important person. So my, how the tables have turned.
I appreciate that. Yeah, full circle for real.
Yeah, exactly. All right. So let's go ahead and jump right into it because all your fans want to know, how did you become interested in counseling?
Hmm. Um, well, how I got interested, I was working with a mentoring program, and one of the young men that I was, supervising in the mentoring program, um, he just told me one day, he was like, "Hey, you ever thought about being a counselor or a therapist?" I was like, No, no. Well, maybe I thought about it, but I don't think I can work with anyone. I don't think I can even get a license to be a counselor or whatever. He's like, you should try. And so I was like, okay, because I have a criminal background, and I thought because of that criminal background, I would never be able to get a license or be able to be hired to be a counselor or a clinician in any settings. But I was like, okay. So I went to NIU. I talked to I think at the head of, I guess, the director of the clinical, the CCTC. Um, and it was Dr. Lockout at the time. And I went to him. I told him, I gave him an outline of my background and what I was incarcerated for. And he told me, he said, you may not be able to get licensed as a therapist. And I was like, or I mean, a counselor or a clinician. And I was like, um, it's okay as long as I can get a job working with individuals. Maybe I was thinking like that I'll do like some type of case management position or something like that. And he said, okay, if you're okay and you understand that, then you know we would love to have you in our program because uh, he said he appreciated my diversity and my circumstances of what brought me here to the program and trying to seek about getting in NIU's program. So that's how it all started, working with uh, youth that had been adjudicated or pre-adjudicated.
All right. Very nice. And, just like what you mentioned with your background, you were first unsure if you could be a clinician, but now look at you. You are a full-fledged LCPC out there doing the Lord's work. Right.
Right.
Mhm. All right. So I know you talked about this a little bit already, but what schools did you go to for your undergrad and your graduate degrees?
Well, I've only went to like I first started off at JJC. I got my associates there. Then I went on to NIU and I got in their sociology program. And I grew a love for sociology and psychology because I wanted to learn about myself and I wanted to learn about my community, like, why the people in my community were, like why were they subjected to only certain circumstances in life? And, also even learning about myself, why I did the things that what made me, why did I do the things I do? And because I wanted to learn and grow from, my mistakes. And I wanted to be focused on trying to create a life for myself, you know, that I didn't really think was possible.
All right. Very nice. Very nice. All right. So, as we mentioned, you went through grad school, do all
Mhm.
those interesting, fun, and very overwhelming classes at times. right?
Yeah.
But then you graduate, and now you're out there in the real world. So then how long have you been doing therapy for?
Um, well, oh, one thing I didn't touch on was the master's program. I did the
Mhm.
master's program at NIU. Um, and after I graduated, I started working at the treatment courts, for the treatment courts of DeKalb. And I did enjoy that space because it helped me learn about me and the things that I wanted to do and the type of clinician I wanted to be with my clients. And I found myself wanting to be more personable. And what led me was I went from the treatment courts to working at a small community mental health agency and transitioned to working private practice. And I've been working private practice now since 2017. So going on 6 years, I've been working private practice, and then another year I worked for the treatment course. So
Mhm.
all together now, I guess 7 years, I think.
All right, very nice. Like I said, I always count my internship and practicum because we technically did counseling during then too. So if that adds on an extra half a year or a year, then I would count
Yeah,
that also.
yeah. Well, 2016 is when we graduated, and then I'd say when I was doing my practicum and internship, that was like I guess 2015. So since 2015 and working either somewhere with treatment courts or in the community, and of course, private practice. And I've worked for few other places too as well. I worked for a big behavioral mental health organization, and I found all these experiences valuable because now I know what I want to do. Now I know the type of clinician I want to be with my clients and the populations I want to work with.
All right, definitely. So then, true, it is February. We're in
Mhm.
Black History Month, right?
Right.
Though well, one of the things I always mention is this shouldn't just be talked about during Black History Month. This should be talked about all the time. And I hope that's
Yeah.
something that we could more push forward on. But since you have a wide array of knowledge and wisdom and experience, I was hoping you could speak to this a little bit. So, how do you identify yourself as a Black male clinician, and how has your experience been in the mental health field?
Yeah. Well, I identify myself as a Trinidadian American because I have Caribbean roots and American roots as well, as far as like where I was raised, where I grew up, and everything. But I still connected culturally to my Caribbean roots, which is Trinidadian. And as far as being a Black male clinician in this profession, I think it's been wonderful. You know, it's given me a perspective of who I am and my self worth because I know Black male clinicians are, I say, to the majority of the people in this profession, very few. And I think like some of the people that reach out to me and or some of the modeling of behavior when people see me or clients see me and they see who I am and how I am in our sessions or one-on-one, it gives them a whole nother perspective of Black males and whatnot.
Mhm. No, that's so true. That's so true. Couldn't have said it better myself. Right. So then speaking to that so then I know you talked about this a little bit before, but hopefully you could go a little bit more in depth with it. But what places did you work off in your profession starting out, and what did you learn as a result from working at those places?
Well, in the treatment courts, that's where I first started. They gave me a chance, and I really appreciated it because I worked with people who had more severe diagnoses from, like schizophrenia and, or bipolar 1, 2. I've worked with other people who are like either borderline or I would say narcissistic personality type, schizotypic. Um, and just having a chance to work with those individuals gave me a whole new, I say, how would you say, it gave me a whole new set of skills to work with those populations, um, especially just getting into the field where you're not really sure. and you have that imposter syndrome, and you're sometimes I would worry about how I would work with these populations. Um, but it really built up my confidence working with those individuals.
Right, definitely. I know, especially when you start working out in the new places and then you're just like, "Whoa, wait, I didn't learn about this in school. How do I help this person?" But you
Yeah,
learn really quick and then you just make it work.
yeah, and I think the only thing I understood when I left there that how I saw my clients, um, and the individuals I work with, and I didn't see them as just a number, or just an individual who might have been in the court system. Um, I saw them as people, and I didn't feel I had the chance to be able to work with them the way I wanted to, use some of the tools that I've learned that I thought would be more beneficial to help them grow, or, to assist them in, just um, looking at their mental maps and everything and the way they view things. So since I couldn't do like the work I wanted to, I felt like it was time to move on. And then I went to a smaller um, behavioral health, a community mental health practice. And I went there and I did enjoy it. I worked with students in high school and grade school, junior high, and I found that experience very valuable, you know. But still, I had to move on, and I found myself working at taking control of private practice, and from there, I kind of learned a lot just working with private practice and honing my skills and honing my confidence. Because, like I said, imposter syndrome was always something that I experienced or I dealt with, while being a new clinician. So I say just that first year of working private practice, I got a chance to find my own voice and find my own style, which was just being me. And because I never knew the power in authenticity. So when I started working with individuals in private practice, I think that's where I experienced my like highest amount of growth.
All right, very nice. Very nice. So, speaking about private practice, and private practice, as you mentioned, that's where you experience your highest amount of growth. You were working at these places, you were doing the Lord's work, just like what we talked about. You were changing lives and all that fun stuff. But then something in your mind said, wait a minute, maybe I can do this all by myself. And then, boom, you opened up your own private practice. So, what was that process that led you to want to start your own private practice?
Yeah. Well, my decision to open up ascension therapy services, which I've found like this has like been a labor of love and a learning experience. Um, as far as wanting to start my own private practice, one thing I felt lacking from a lot of my other private practice was like a safe space. And what I mean by that, as a Black male clinician, and then being part of the community or just being part of this world, as far as watching and experiencing the things that we experience from a day-to-day basis, as far as like what we see on the news, whether it's, it started way back to Philando Castile and, George Floyd and everything. And being in spaces that would never acknowledge those things. Like, you're working with everyone and no one really checks in on you. No one ever says like, hey, man, I saw what happened in the news. How did that affect you? And so my thought is like, it felt like I'm working for these individuals and no one really cares about what you're experiencing or what you're going through. So my thought is I want to be in my own space. If the people, the very people that employ me, doesn't want to really check up on me or doesn't really, you know, ask me how am I doing just in the climate of things, because I felt like all these social justice issues really affect the Black community, but you know, I very rarely hear, even from colleagues, I never really hear them telling me like, their white colleagues, and these are people that we've been in the program with, and we're taught about these social justice issues and how we can be like, say, advocates in our field. And, I felt like that was lacking. And so I wanted to create a space where, say other clinicians who are BIPOC, where they could come in and if they want to talk about things, if they want to just share their thoughts, their experiences, and also give them like not only a nice, safe working environment, but give them a space where they feel more connected. And so I wanted to create a space that was more cohesive and more connected and really looked out and really appreciated the people that work for them.
Right. Very nice. Well, I don't know how I'm gonna connect that one with the next question, but I'm gonna do my best because that was such a deep answer. I appreciate that. But I'm always curious though about why people choose the names they do for their businesses. So,
Mhm.
like for me, I didn't put much thought into mine. It just sounded cool, so I went with Max Empowerment Counseling. But you
Mhm.
though, hopefully you put a lot more thought into Ascension Therapy. So, why did you choose the name Ascension Therapy?
Well, when I think about ascension, I think about us like, finding awareness. I think about us growing. And when I think about us growing, I think about us going upward when we grow, when we're continuing to fill up, our knowledge or understanding of ourselves and everything. So when I think about ascending and growth, I think it's all interconnected. So, when I think about ascension, someone who's um, has a chance to like either uplift themselves or grow in some type of way. So that's how I came up with Ascension.
Right, very nice. So you definitely did put a lot more thought into your name than I did. All right. Yeah, just a little bit, but no, a lot. A lot. Right. All right.
No,
So
I like Max Empowerment though. So,
it's a cool name. It really is a cool name. So thankfully, whoever in the universe decided my last name should be Mac, or
yeah.
else it wouldn't have been as cool.
Well, I think you did that name justice yourself.
Well, I appreciate that. Thank you. I do my best. All right. So I like to ask these of business owners a lot too, especially with people starting their own private practice. But what hurdles did you experience opening up your own private practice?
Just not really knowing enough. I feel like this is something I'm still learning at. So I'm still learning different nuances or just different things like from a business perspective that I didn't know. And also like, trying to find mentors that may assist or help. And, sometimes people, they have good intentions on assisting you and everything like that. But sometimes people are busy with their own lives. So you can't really connect to them when you're trying to learn something and you need to know it by next week, or you need to implement it, or it's something that you just have no knowledge of, And so like I've been steadily learning, as I go, and as I continue to grow, like whether it's like welcoming interns into the practice or specific name like whether it's an LLC or a PLLC. All these are aspects that I'm steadily learning every like every day essentially.
Oh, no, it's true. When you start your own practice, it definitely comes with a learning curve.
Learning curve.
hmm Oh man, I got stories upon stories when I was opening up my own, especially one where it's like I have to pay how much money just to get in front of people to see if I could start my own business in the first place. Because that's when I
Yeah,
had to get my business license for the city. So that was, ooh, that was a process.
yeah.
But
I think just even like when deal with day-to-day things like electronic health record systems and everything. There's so many different um, variables you need to consider when just, finding the right one for you, or how many people you intend to employ, whether it's now or 6 months or a year from now. All these things are important factors when, choosing the right electronic health record system. And so, that's a thing I didn't really consider, because I've been employed at different spaces. And so I think every place I've been employed, they use something different. So okay, I'm familiar with all these systems, but which one do I really want? Which one do I really need? You know?
Yeah, definitely. And have to do your research, saying, okay, this one has this, but this one has that. And then
Yeah.
when you actually go with one, you're like, oh wait, this isn't what was promised. And you have to scrap the entire thing and go with a new one. So
Yeah.
yeah, if I feel your pain.
Yeah.
Oh boy. But we could talk about that for hours, I'm sure. But
Sure.
a little shameless plug for you and your private practice. So, what projects are you currently working on in your private practice that you would want people to know about?
Well, currently right now, I also see, sex offenders. I work with sex offenders. With and it's I have a unofficial contract with IDOC, and just that as far as it's a population that not all therapists want to work with. So there's a need for therapists, and I guess programs that will give them the best assistance and outcomes and everything. So I've been working with sex offender um, population since probably for like a little over a year. I started working at the last practice I was at. And when I left that practice, I was trying to decide if I wanted to continue to work with that, because I wasn't taking Medicaid or whatever, and a lot of the clients were on Medicaid. So I just decided to work with them and give them a sliding scale fee, and able to work with them. And even that has its challenges, because you have to think about where these individuals are at once they're paroled out, and as far as being able to afford. So I find myself having to work with them a lot more than I have to work with other individuals that come in to see me. So even that in itself has been a learning curve. But I find it very valuable, because what I'm able to talk to them about and work with them, and at some point I do talk to them about you know getting past their stigma, and as an individual who was incarcerated, having that stigma, that label, where you may feel less than, but trying to use your experiences as a strength. And so I find it like a very rewarding to work with those individuals in that population. And also, I also been working with individuals who have experienced like trauma, PTSD. I do EMDR. I've been trained in EMDR. So yeah, those are the two populations um, you could say, specialize in, or specialize working with. But I work with everyone from anxiety, people who have experienced anxiety or depression, or whether they're just trying to figure out where they're at in life. I think, NIU's program gave me a good, solid foundation as far as being able to work with um, a diverse, I say, a diverse body of population. So what I mean by that, being able to work with individuals who are trying to figure out what they're doing with their career. Because like when I was at NIU, I was part of the, we have to do like say, we can either like teach a class and everything and learn about career. Um, we taught this class called Exploration to Careers, And so like it helps you, gives you an idea as far as like working with students, whether they're college students or whether they're high school students, and they're trying to figure out their careers and try to figure out what they do next. And I never thought that once I taught that class, how beneficial that would be to working with individuals in the community, because sometimes people even get to a certain place in life and they've been doing a career and now they feel stuck. They don't know what they want to do next in life, or they're just stuck between two or three choices and they really don't know which one they want to do. So I found those things that I've learned along my journey very beneficial to working with those populations as well.
All right. Very nice. Very nice. That is,
Yeah.
like I said, you are out there doing the Lord's work, so that's great. Right. So you've imparted a lot of knowledge, wisdom, and information onto us already.
Hmm.
So just to part just a little bit more, not too much, but I guess it depends on how you want to answer this next one. What advice would you want to give someone that is looking to start their own private practice?
I would say definitely find you someone who can mentor you. And I say it's essential that, you work in a private practice as well. And I say give yourself some time, learn the different nuances, work for a private practice for at least a few years before you make that commitment and that decision to work for, like, to own your own private practice, and continue to you know I guess be involved with whatever trainings that you can come across, or even workshops that you may come across, just so you can learn, because it's like you never know enough. And I say if you can, like, maybe find a mentor that has their own private practice, that would be very beneficial too. Because like I've talked to a couple of people who have owned their own practices, and they've given me such insight and helps me grow as an individual, as far as, things that I never even considered about opening up my own private practice, and yeah, I think it's been, you know, probably one of the most beneficial things. And just, you know like, hey, I would like for you to, like, just possibly tell me a few things, or can you be so kind to just, like, mentor me. I've asked people to just mentor me and everything. And some people are very accommodating, and like I said, some people are so busy running theirs that they may not have time. But I don't take any type of offense, and you shouldn't take any type of offense to it. Just keep on asking, and someone will assist you eventually.
Yeah, that's true. Someone will assist you eventually. So just keep on plugging away. Right.
Mhm.
Definitely great advice. All right. So we're down to our last four questions. And
Oh
I mean,
wow.
yeah, I know. See, time flies. I know that all the good things must come to an end, but that doesn't have to be just
Mhm.
yet for this interview, because this next one is a really important question that I know that you're extremely passionate about. So, in regards to the vitiligo population, hopefully I said that right. So, what
Yeah.
work have you done with the vitiligo population?
Well, I've advocated for, like, mental health services. I've talked with some of the leading dermatologists about, uh, I would say, verbiage and the words they use. That can, I feel like words have a power to create or destroy. So, keeping in mind that when they say do no harm. Harm can be psychological as well and emotional as well. So, like, some things that the doctors don't consider is some of the words they use, like whether they're using disease, the word disease, with a room full of people. And I always try to tell them, like, keep that in mind when you're using those words. Same words you use with other professionals, you don't go home and use with your family members, right? So, you need to be careful of the words you use with your clients or with your patients. And not everybody who has vitiligo is a patient, because some people are okay with where they're at in life. And me, myself, I speak toward, like, acceptance, because there's no cure for vitiligo. Um, there's only treatment. And what does treatment mean? Treatment means that if you're taking a treatment, it may not work effectively, or your pigment may come like may repigment for like a very short time, and that may exacerbate the vitiligo, so it will come back even stronger. And I try to work with people to um, facilitate awareness about, how acceptance is a cure too as well. So like, or before you seek a cure, at least work with a therapist, work with a counselor or a clinician, so you can get a greater sense of yourself. Because if the treatment doesn't work, what I found in the community, that often people would like it would experience a lot of depression, a lot of isolation, because they feel really down or dismal about their situation, as far as their pigment not being able to, um, I say, repayment fully. So, I always speak about the power of mental health and the power of acceptance, the power of self-love, because if you accept yourself, that's healing as well. So, I say a lot of times when individuals are experiencing suicide ideations, someone will contact me from the vitiligo community, and they'll give my name to someone about working with them. And, it's been something that I found so endearing and loving, because it's something that I love to advocate for. So like whether I'm working with some of the people from the community and throwing together, like, say, a photo shoot, because I feel like photos, um, they speak like, a million words. So like, what a person feels when they see a picture can carry a range of emotions. So, I try to put together photo shoots to help people like step out of their comfort zone, whether they feel like they don't look good in pictures. So I may partner with professional photographers. I may partner with journalists so they can like do a story on it, just to spread awareness, because I don't think there's enough awareness about the this community or this population, because often people are even thought of having some type of leprosy, or they're some type of burn victim or something, or people might think it's contagious. And it's like 2023, and for people to not know, or people to be unaware, and of what a person, like, how this is just like some type of condition, autoimmune disease, or disorder. I like to use the words condition or disorder, because those are some names used with research. And I feel like it's less impactful than using the word disease. So like some of the work I do is just like helping doctors understand the power of their words, and you know trying to make an environment, or build a community of awareness and understanding, of any individual that may work with the vitiligo community, whether it's a clinician, whatever. But I'm a huge advocate for mental health in that aspect.
All right, definitely. Well, you heard it here, folks. If you have any questions or looking to learn more about the vitiligo community, definitely contact Andre. He will be happy to give you all the insight and the information.
Thank
Yeah,
you.
no
Definitely.
problem. All right, so now that we're getting down to our final three questions, first one
Mhm.
being, so is there anything that you would like to tell people starting out in the field or who have been in the field for a while?
Anybody who's just starting out in the field, I say authenticity is something that's underrated. So, don't try to be like anyone. Just be yourself. Often we'll see other clinicians and we'll see how amazing they are. We want to model ourselves after them, but you have to realize you bring a lot of strength, especially with your experiences in life. So, hold on to those aspects in your experiences, because that's what's going to help you connect to your clients and to those populations. I say clients, they are very keen. They will pick up when you're not being genuine, when you're not being authentic, and I would say that's going to be the hugest, like, that's going to be the biggest builder of your resume, when you get to working with clients. And when you do like some really good work, they're going to give referrals. Like, because most of my clients I have now is because one of my clients referred, and then another client referred, or maybe just from one client. I probably have like about probably like a good 15 clients from just one client I work with. So, um, and also be patient, it just, getting referrals and everything just doesn't come like that, and you can talk to other clinicians if you need assistance as far as like, what to do, what type of things you should look at when you're trying to get referrals and whatnot. So, I think as far as trusting your instincts, being authentic, um, those are some key things that um, that you need to know. And just remember that you're human. Just remember that you will make mistakes, and that's okay, but own it, acknowledge it, and and keep on working. Do your due diligence to get trainings, or be able to attend workshops or whatever, because it's something that we're continuously learning about people, or learning about cultures, across, the span of generations, because what works for one generation may not work for the next one. So always taking your time and educating yourself, um, you know, thoroughly, is something that I say is needed and is important. Don't think that, yeah, I just graduated. I know everything I need to know. And I can click with whoever I want to click. No, you always need to know, especially just like as, certain things change, whether it's acronyms and everything, that can be something that can, um, I would say, impact the way you work with clients and how clients see you as being very affirming or welcoming to their spaces.
All right. Great advice. Great advice. I love it. So that's got me curious for how you're going to answer this second to last question before we get to the most important one, right? So, is there anything that you'd like to say that I haven't had a chance to ask you about?
Um, I can't really think to say. I think you've been very thorough as far as like, questions you asked. Um, yeah, I can't really think to say anything, besides, if you do have things that you want to look at, definitely staying in tune with ICA, attending ACA. These have been some very um, critical experience that helped me grow and even learn from others. Because once you attend, say, the ICA, the conferences or whatnot, you really have a chance to learn and grow. So, don't pass up those opportunities. If you can be a student worker and everything at the ICAs, go ahead and attend if you can afford to attend, instead of like, focusing on going out or hanging out with friends. Put up that money so you can travel to ACA, because that is such a great experience as being a clinician and being around other clinicians. The energy, and even, connecting with people who have very similar ideologies, or even different ideologies than you, that will help you foster growth, or those experience to grow.
Yeah,
It's
definitely.
necessary.
Those are necessary. I 100% agree. So, you heard it here, folks. Andre wants you to go to ICA, ACA, and MCAS conferences. So, make sure you go to those and get a lot of information, network, and yeah, just meet new people, get new experiences.
Yeah.
All right. So, now for the most important question, right? Where can people contact you if they want to learn more or want to connect with you?
Well, my contact information, you can either email me at andre@ascensiontherapyservice.com. You can give me a call at my office, which is 630-657-9655. And I'll definitely get back. I take my time to get back to everyone as quick as I can because not only am I seeing clients and I'm, supervising interns, but at times I'm also teaching as well. So, I've been teaching this semester at National Louis and definitely enjoying the ride as far as teaching and connecting students and working with students to hone their skills and build upon the things that they've learned and their experience applying that theory to practical applications. So, I said you can contact me at either one of those spaces and I will get back to you.
Right. Also, I'm pretty sure you have a website you want to promote too, right?
Yes, ascensiontherapyservice.com. Service with the E, no S.
Ooh, with an E, no S. That's fancy. All right. Other than that, then that'll be it for this interview. And based off of the answers that you gave me, we can definitely do a part two. There are some other things that we should 100% follow up on, engage your experience and your wisdom and all that fun stuff on.
Definitely. Thank you so much. I appreciate you for having me. I definitely look forward to seeing you and possibly seeing you at conferences and talking some more.
All right.
I appreciate it.
Perfect. Sounds good. Hey, that's
All
what I'm
right.
about. Conferences, talking. Mainly if I get free food, I'll be there. But I mean, you never know. Right.
Okay, everyone. Happy Black History Month.
Mhm. That's right. Power to the people. All right, everybody. This is Coresair Mack signing out. Again, I'm the president of the Illinois Mental Health Counselors Association, and I'll see you all in the next interview. Take care.